Hello everyone. In this video, we will talk about drug dosage forms. So these drug dosage forms are the forms in which drug molecules are bound together so that they are properly absorbed in the body and are delivered to their sites of action. So what is the need for different drug dosage forms? Fundamentally, it is for proper administration of the drug. Okay, so that it adequately reaches to its site of action. And why it is required? Because sometimes the drug may have a different taste, odor, which the patient may not like. So for proper delivery, we need to give it in a proper form. Then to give accurate dose of the drug, protection of the drug from getting destroyed, use of desired vehicle, and also controlled release of the drug in the body. So what are these different drug dosage forms? Well, these drug dosage forms are classified based on their physical form and based on their route of administration. So in this video, we will talk about the physical form, and in subsequent videos, we will talk about route of administration of different drugs. So when we talk about physical form, that means the form in which the drug is being delivered. Is it in solid form, semi-solid form, liquid form, or gaseous form? So in these different physical forms as well, we have different types. So first we'll see the solid form. In solid form, we have tablet, capsules, pills, lozenges, pastilles, granules, powder, and suppository. So what are these? So first is tablet. Tablet is generally made with a binding agent. We have the powdered form of the drug and it is combined with a binding agent and also some sweetening agents, flavoring agents to hide the taste of the drug, make it easier to swallow, and to make it more resistant to the environment so that it is not destroyed immediately and the drug is released where it is supposed to be released. So these are the forms of the tablet which you might have seen. Now these tablets can be either coated or uncoated. So this tablet, if you see, in which you see a line in between, this is uncoated tablet. However, this tablet you see, it is having a covering, so that is a coated tablet. So in these kind of coated tablets, you will not see a line in between. And why it is important to know? Because this kind of uncoated tablet can be broken into sub pieces and even smaller doses can be taken. But a coated tablet means that this tablet is designed so that the drug is released at a particular site in the body and then the drug is absorbed. If we break this particular tablet, then the coat will also be removed and then the drug delivery becomes ineffective. So that is about tablets, and these tablets are given by oral route, that is for swallowing. But we also have chewable tablets. You can just keep it in mouth and chew. Then sublingual tablets, example being isosorbide nitrate given for angina. So this tablet is kept in the mouth sublingually below the tongue and from where it is absorbed. Then we have the enteric coated tablets. That means the tablet will have a coating such that the coat is released in the stomach and from there it is absorbed. Then we have sustained extended release tablets. In such kind of tablets, drug is released at different rates. So there is extended release. Then we have controlled release tablets. In these tablets, there is a semi-permeable membrane at the top so that a particular amount of the drug is released in a particular time. So that controls the release of the drug. So whole drug is not absorbed together, but there is a particular rate so that the amount of the drug is slowly released from this tablet. Then we have effervescent tablets. Effervescent tablet example is Disprin. Disprin is basically a dispersible tablet. That is why Disprin, dispersible aspirin. So this is an effervescent tablet which is put in a glass of water and then the drug immediately dissolves in the glass of water and then it is immediately taken. So this enhances the absorption of the drug. So there is a fast action of the drug. Moving on to the next type, that is the capsules. So capsules basically they have a hard gelatin or a soft gelatin cover and inside this, so if we remove this cover, inside this the drug will be there. In the hard gelatin capsule, we have dry powdered ingredients. However, in soft gelatin capsule, which can be compressed also, we have a liquid which is filled inside it. So this soft gelatin is for oils or active ingredients which are suspended in oils. Apart from this, there can be enteric coated capsules, which again, these capsules, the coating is removed on reaching the stomach. Then we have spansules. Spansules, as you see the diagram, within this capsule we have drug which has different coatings. So that is why different colored drug granules are there, and this dissolved at different range of time period in the body, so that the whole drug is not absorbed together. In fact, it can be spaced. So that is the spansules. Moving on to the next, that is pills, lozenges and pastilles. So pills are again the dry form of the drug which is mixed with honey or syrup to make it sticky, and then it is rolled into like a tablet only. So it is like another form of the tablet, but this form of drug administration now is not used. Then we have lozenges. Lozenges, one example is like cough lozenges are available. If we want the action to be in the throat, we want the drug to remain in the mouth for long time. So that's how these lozenges are made, so as to retain the drug in the mouth for longer time. There is a drug which is combined with the sugary substance and gum, which binds this drug and causes the slow release of the drug as long as the lozenges is within the mouth. Then we have the pastilles. Pastilles base is either glycerol and gelatin or acacia with sugar. So these both lozenges and pastilles dissolve slowly in mouth and are important for the local action in the mouth and throat. Next is granules and powder. These granules and powder are used when the amount of drug which needs to be administered is more, it is in gram. So these granules like vitamin D granules are available. These are available in sachets. And another example of these granules and powder in sachets is ORS solution. So this is a single dose sachet. So large amount of the drug needs to be taken, and this can be taken directly in mouth and then gulped with water, or it can be effervescent, it can be dissolved in the water and then taken. So since this is very inconvenient form of drug administration, this is only used when large quantity of drug needs to be administered. Okay, so this is the oral administration. Next is by means of the topical bulk powder, where the bulk powder is in container, and generally it is used for some skin diseases and all, where the powder is provided in plastic or metallic containers, and these containers have holes for the sprinkling of the powder. Then moving on to the last part of the solid dosage form, that is the suppositories. These suppositories are the dosage forms in which the drug is enclosed in conical bullet shaped dosage forms. So these are rectal suppositories, and these are conical bullet shaped forms which are inserted into the rectum. Then similar we have pessaries. Pessaries are vaginal suppositories. These are known as pessaries, and these are globular or ovoid, and again these are for local action. So these suppositories are for local action in the rectum, in the vagina, or also in the urethra. The urethral suppositories are also known as boogies, and these are slender pencil shaped, because urethra means the opening will be very small, so they have to be very fine, very thin. So these are slender pencil shaped and are inserted into the urethra for local action, maybe antibacterial, maybe local anesthetics. So these were the various solid dosage forms. In the next video, we will talk about other drug dosage forms, that is liquid, semi-solid and gaseous dosage forms. Thanks for watching the video. If you liked it, do press the like button, do share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.